Hello, and welcome to today's Friends Life Care webinar, Fight the Bite, What You Need to Know About Tick and Mosquito-Borne Illnesses. My name is Katie Starantino. I am a Friends Life Care Wellness Coordinator, and I will be your host for today's webinar. Before we get started, I'd like to go over some housekeeping items. The link to today's handout is in the confirmation email that you received an hour before the webinar. The handout link will also be included in the follow-up email that you receive tomorrow afternoon. While there is not a chat feature for today's presentation, you may submit questions by clicking on the Q&A box at the bottom of your screen. If you don't see the Q&A feature on your computer, you can run the cursor over the bottom of the screen and you will see it. So now I would like to introduce Alexis Lambert. Alexis is a disease intervention specialist with the Montgomery County Office of Public Health. She started with the county in July of 2020 and has worked on investigations for a variety of reportable diseases. Prior to working at the Office of Public Health, Alexis attended Penn State University, where she earned her Bachelor's of Science in Biology in 2019, and then went on to attend Arcadia University, where she earned her Master of Public Health in 2020. One of her favorite aspects of the job is the ability to interact with community members and have educational moments with them through the conversations had. When Alexis is not working to prevent disease, she enjoys spending time with her fiance and her dog, Penny. And with that, I will hand it over to you, Alexis.
Good morning, and thank you so much for that wonderful introduction. And thank you all for having me today. It's a really great topic to be discussing with you all today, and I hope you gain a lot of knowledge from it. So we can kind of jump into our presentation here. And we're going to talk a little bit about both tick-borne and mosquito-borne diseases. So I've created some lists here that kind of go over some of the more prevalent diseases. The tick-borne, we'll talk about all 4 of those and how they relate to our region and how they may affect you potentially. And then we'll briefly touch upon some mosquito-borne and some tips there. Luckily, it's not super prevalent here in the US, but definitely some things to note there. So just so you have an idea relating back to those couple diseases that were listed there, these are the most common reported tick-borne diseases in 2018. So that's the most recent data that has been fully compiled, cleaned up, and aggregated. And this information is from the CDC here. So you can see that the most prevalent tick-borne disease that has been reported is Lyme disease, which we'll spend the most of our discussion and focus on here in this presentation. The next highest is the spotted fever. We won't actually be discussing that here. It's typically found on the West Coast and more of those mountainous regions. So something to kind of keep in mind if you do plan on traveling out that way and spending some time outdoors, but not really prevalent in our direct area. And then in much lower prevalence, you can see the remaining reported diseases. We will touch upon Aplasmosis, Babysiosis, and Liquiosis. All right, so we're going to focus on the biggest culprit here, and that is Lyme disease. So this is also data from 2018 from the CDC, and 95% of reported Lyme diseases are from 15 states specifically, and you can see them highlighted here. And this huge portion is in this Northeast region where we currently are. And so each year, approximately 30,000 to 40,000 cases of Lyme disease are reported, but over 500,000 people are actually diagnosed with Lyme. And that's such a disproportionate because not all physicians choose to do some testing, which is what ends up being reported, but they just clinically diagnose with Lyme based on symptoms and kind of other background knowledge that they have on the patient. In Pennsylvania specifically, in 2018, there were about 8,000 cases of confirmed Lyme disease and a little over 2,000 cases that are considered to be probable. And we use the terms confirmed and probable as our case definitions when we're doing investigations. So confirmed typically has both lab criteria and clinical criteria that meet what the CDC has defined as a confirmed case. And then probable, there's a couple different reasons it could be downgraded to a probable case. Sometimes there's incomplete clinical information. The proper testing to fully confirm a Lyme disease isn't completed. There's other unknown details as we're moving through that investigation. So just so you're kind of aware, and based on those numbers, Pennsylvania is considered a high incidence state of Lyme disease. So what is Lyme disease? That's the big question. So it is a bacterial infection that is spread by the bite of an infected tick. And the infection is caused by the bacteria Borrelia burgdorferi, and it is a corkscrew-shaped bacteria. So you can kind of get an image of what it looks like down here in the lower right-hand corner. Almost looks like a little worm, but they are microscopic. And black-legged ticks are the ones that carry this bacteria. They're most commonly known as deer ticks. They are really one and the same. The terms are interchangeable. And then Lyme disease is also one of the 74 reportable diseases in Pennsylvania. So it's something that is tracked surveillance-wise, number, region, all that good info, and then something that the local health departments and then the state health departments also follow up on and investigate, speak with providers about, and then speak with individuals directly about as well. So the reservoirs for this bacteria are wild mammals and birds. They carry the bacteria. They often don't become ill. They're asymptomatic. So when a tick is on these mammals and birds and they bite them, they then contract the bacteria and carry it. And then when they then become on you and bite you, that's when they can transmit the bacteria. So just there is kind of like a life cycle there, just so you are aware. Looking at Lyme disease up close, these guys are very small. This is a reference into the size of a quarter over here. And these are a couple different stages of the black-legged tick, which is what we see here most commonly in our region. So all the way to the left, we have this larva stage. It's typically active in July, August, and September. And at this stage, it cannot transmit any disease yet if it does carry it. The next guy moving to the right, the nymph stage. This is most active in May, June, July, and August. So those kind of warm spring, summer months when we're also outside a little more. And this can transmit both Lyme, Babysiosis, and Aplasmosis. And this is the most common stage where disease is spread. And this is what you would typically find on yourself if you do find a tick on yourself. They're very small and they like to hide in crevices of your body. So this is why this is most often the culprit of disease transmission. Moving on is the adult male. These guys are active all year round except summer, so a little bit flip-flop from the previous two stages. And these individuals are not able to transmit disease. So adult males are ticks that you wouldn't need to worry about. And then finally, all the way to the right are the adult females, and these are the largest size in their cycle. They are active in both the spring and fall, and they are also able to transmit disease, both Lyme, Babysiosis, and Aplasmosis. These guys are much larger and easier to spot on you, and you can typically remove them before the transmission of disease is possible. So just so you're aware, if you find any tick, you would definitely want to remove it as quickly as possible, but this nymph stage is the highest potential to transmit disease. We're going to discuss some myths and facts of Lyme disease. I'm sure you've all heard some of these in the past, but hopefully we can dispel some of them today. So Lyme can only be transmitted from the bite of a deer tick. It cannot be transmitted from person to person. So you would need to have a tick somewhere on you, kind of bite you, feast for a little bit, and then potentially transmit that bacteria. And the tick must be attached for at least 24 hours before transmission can occur, but most would happen after the 36 hours. So if you're very vigilant after you've been outside, you're finding ticks, removing them as soon as possible, your chance of contracting any disease from them is very low, which is something we'll kind of discuss a little further in our prevention portion of the discussion. But just so you are aware, it would take some time for that tick to dispel that bacteria. Some further information here, ticks don't jump, fly, or drop from trees. They actually rest on the tips of grass and shrubs. So if you're walking on the edge of a trail or an area that has high grass, when you're walking against that and brushing up against it, that's when the tick can then be transferred onto you, kind of climbs onto you as the new host. So you'll often find them more around kind of your feet and leg region, because that's where you're in touch with those types of things most often. Some signs and symptoms to think about when you're looking for Lyme disease or thinking about Lyme disease. Infection can develop anywhere from 3 to 30 days after that tick bite, and we would call that incubation period. So from the point of the bite to your day of symptoms, that's the incubation period of the disease. And most people often think of the bullseye rash when you think of Lyme disease, which can be pictured over here on the right. It's got kind of a center and then an outer ring that looks like a bullseye. Some other symptoms you can experience are fatigue, some fever and chills, muscle and joint pain, and then some swollen lymph nodes as well. But some things to note, not everyone develops this rash, although it's very common. That's not everyone's symptom that they experience. And then in general, not everyone develops symptoms if they do perhaps contract Lyme disease. And Lyme disease is actually nicknamed the Great Intimidator because it mimics the signs and symptoms of a lot of other illnesses, and it can be very generalized. Symptoms can last anywhere from 7 to 14 days. So if you do kind of experience any of these symptoms and you've kind of been outside, you may have had a tick bite, it's definitely something to follow up with your physician about and discuss the symptoms. Let them know what your previous activity might have been if you do spend time outside, and they can help kind of evaluate from there what next steps might be. But it might not be something to brush off just because it's very generalized. So these are some other Lyme disease manifestations. So within that first month is your typical symptoms that we just discussed. In that 1 to 3 month range, there can be some further complications that develop, although not common, just things to be aware about. So you could have multiple of those bullseye rashes. Some people develop some facial droop or Bell's palsy, and then some other further complications. And then if it lasts longer than that 1 to 3 month period, most often people develop some sort of arthritis in their joints, some pain, some swelling. And this is often signs if it's left untreated. So some people may experience all or none of these late symptoms, and you can be prescribed antibiotics in these later stages as well. It's not a limited time treatment. And even with treatment, some symptoms can prolong and be ongoing, but more than 2 courses of antibiotics are not typically recommended if symptoms continue to persist. So definitely something to still continue to discuss with your physician if this happens to be a case for you. Although pretty rare, if caught in the early stages, antibiotics are very effective. This is a big question everyone always wants to know, is how to remove a tick. And it's a pretty simple process. When you do identify a tick, you'll want to find some fine tip tweezers that you can easily manipulate, and you'll grasp the tick as close as possible to the skin surface. So typically the head is in the skin. You'll want to grab as close to that as you can, and you'll want to pull straight upwards with the steady and even pressure. You don't want to jerk or twist the tick, because you may lose grip. You may only pull half of it out. The goal is to pull the whole thing cleanly out. And then after you remove the tick completely, you'll want to wash the bite area with soap and water really well. If you want to put some rubbing alcohol on, you can. But we do recommend that you don't use any Vaseline. You don't use rubbing alcohol directly on the tick while it's still attached to you. And some people like to use matches. Don't use matches because all of those actions can disturb the tick, and it could make it release more of that bacteria further into your skin. So the goal is to do it as soon as possible, and then as efficiently as possible, removing the whole tick. And it's not usually useful to keep the tick afterwards for testing. Most facilities don't have that capability, and it's not always an accurate representation of whether it is truly carrying Lyme disease. So there's no need to keep a tick after you've removed it. All right, so treatment for Lyme disease. So most tick bites don't transmit disease. Most ticks don't carry Lyme disease, but there is the possibility, which is why we're discussing it. So treatment may be recommended after you do have a tick bite. If you've been in a geographic location that is associated with Lyme disease, or somewhere in this Northeast region. If the tick was removed within 72 hours of the bite, treatment may not be recommended. If the tick was engorged with blood, that has indications that has been kind of feasting for a while. It may have been attached for some period of time. And then you would also want to make sure is that black-legged tick that does carry Lyme. So these would be questions and factors that your physician would discuss with you when talking about a tick bite you had. So yes to all those criteria, if you have symptoms and it indicates Lyme disease, antibiotics may be prescribed. And most commonly that is either doxycycline or amoxicillin. And they can be prescribed anywhere from 14 to 28 days. So it all depends on how soon that tick bite was compared to when you saw the physician, and then some other generalized healthcare factors that are personalized to you. Okay, so we're going to switch into prevention, which is what we hope to do in public health, is to prevent any disease. Although we are really able to treat this disease, our goal is to prevent it. We like to think of it as an upstream effort to prevent any downstream effects, what would be disease. So one of the best things you could do is when you're out and about in the woods, walking on a trail, is to walk in the center of the trail and not so much towards the edges. When you're around the edges, that's when you're starting to brush against vegetation, you're getting into kind of the thick of it. So the best way to avoid ticks is to kind of stay in the center of the trail. You'll want to wear some light colored clothing. That way, if the ticks are on your outside of the clothing, you can spot them much easier because they are a dark brown to black color. So you'll be able to remove them right off of your clothing before they even touch your skin directly. And the best thing is to wear full length clothes, so long sleeves, long pants, closed-toed shoes. And some really great tricks are to put your socks on the outside and tuck your pant legs in. That way there's no avenue to kind of get into like where your socks are or kind of get underneath your pant legs at all. It kind of all seals it off. And some people, even when they're walking through more of a brushy trail, if you're going into like a deep wood trail, is to put tape kind of inside out around the bottom of the pant leg. And when the ticks are kind of climbing at that lower level there, they get stuck to the tape and don't ever migrate up your body. So just kind of some tips and tricks that are had there. You'll want to shower soon after being outdoors and perform those daily tick checks. It's really great if you have some sort of buddy that can help check some areas that are difficult to see, your back, things like that. And always check kind of like the crevices areas, because that's where they like to kind of crawl and hide, where it's difficult to see. So always do a thorough check kind of from head to toe. If you're an individual who has longer hair, if you're able to put your hair up or put it in some sort of hat, that also would prevent anything from kind of crawling in that area. Another great tip is to use an EPA-approved insect repellent. So one of the most common active ingredients is DEET that helps repel those insects. And the percentage of DEET actually indicates how long the product is going to be effective for. So anywhere from 4 to 100% is safe to use on your skin and on your clothing. But over 50% doesn't actually add any additional protection. It would just lengthen the time period before you should reapply that product. It's always good to follow the instructions. And then, most of these insect repellent and safety products can be bought at some common stores, such as Walmart, Target, those big box stores, or you can typically find them at sporting goods stores as well. And then don't forget about your pets. Everyone loves to take their pets outside with them. They should also be treated with the same care and caution as for yourself. Tick checks when you come back in, regular treatment if you're able to do that with, medication or kind of the gel that you can sometimes put on your animals. So always something to think of them as well. They're lower to the ground. They like to crawl in all that bushy area. So definitely consider your little furry ones as well. This is kind of just a fun, quick image to illustrate a lot of those protections. So this is an old coworker of the Office of Public Health. She's got long sleeves on, long pants, those closed-toed shoes. She is wearing a hat, but one thing to note, she doesn't have her hair up. That would be one extra step she could take. And ironically, they decided to take this picture kind of in the brushes. So you would definitely want to stay out of that region where ticks could be hiding. So definitely some things to spot on here that you can do differently, and maybe that'll help you remember when you're out and about. Some environmental protection. This can be kind of maintenance that you can do on your own to help prevent ticks from being more prevalent in your habitat. So one thing to do is remove any debris or leaf clutter where they could kind of hide and hang out on. If you're ever removing that come fall time, it would be good to wear all that same protection and maybe some gloves as well when you're carrying that foliage out. You'll want to maximize sunlight. Ticks do not like to be in the direct sunlight. They don't like to be like in the short grassy area. So if you're kind of out in your general yard and the kind of a field that's mowed very regularly and in direct sunlight, you'll likely not find any ticks there. They don't like that kind of habitat. And some things you can do, if you have some sort of backyard that's up against the wooded area, you can place some sort of barrier that would help prevent ticks from slowly migrating there. So this image on the right here shows a really great example of placing wood chips or gravel to create some sort of barrier between that brushy area and then the grass. You can also spray with additional pesticides as well that's meant to treat foliage. Okay, so that was Lyme disease kind of in a nutshell. Hopefully if you guys have any questions, you can send them into the chat and we'll try and address them at the end. And then we're gonna kind of move into some other tick-borne diseases here. So we're gonna focus on the other three that are less common, but still something to kind of note. We have Aplasmosis, Babysiosis, and Liquiosis here. So Anaplasmosis and Babysiosis are caused, or the bacteria is carried by the same tick as Lyme, the black-legged tick, and then Liquiosis is actually from the Lone Star tick. They carry that bacteria. Okay, so Anaplasmosis here, it's caused by the bacterium Anaplasma zygoside, and this is carried by deer ticks, which we had just mentioned. Transmission can occur about 24 hours after a tick has attached and started to feed. So they like to kind of suck on your blood when they fully attach to you. And then symptoms may not present for another 2 weeks. So very similar to kind of the presentation and timeline of Lyme. The sooner you can remove the tick, the better off. And symptoms are also similar to Lyme, which can be tough to differentiate, although a rash isn't common like it typically is seen with Lyme disease. If something like anaplasmosis is a thought or something that shows up on blood work, it can also be treated with doxycycline. This is pretty rare. We see about 10 cases a year here in Montco, so not something that's often seen in the tick population. If there is any concern, if you do go see a physician and they recommend some blood work, there's often a panel that they'll do that tests multiple potential tick-borne diseases that are relevant to this area. All right, and the next one is our Liquiosis. This disease is caused by a bacteria that's in the Ehrlichia species family. So there's a couple of different subspecies that could populate, but they're all generally the same and from this larger species family. So this one is caused by the Lone Star tick, and you can see him up at the upper right-hand corner here. Looks a little different than the black-legged tick. And you can see it's got kind of a white patch on its back that somewhat resembles a star. So that's where its name's from. This is also a pretty rare disease. There's about 2,000 cases reported in the whole US alone, and this data is from 2018. And then in PA specifically, there are about 3 to 5 cases that were reported in 2018. So some signs and symptoms that are associated with this, they can occur about 1 to 2 weeks after the bite, some fever and chills, headache and muscle ache. This one can come with some GI symptoms as well, most often some diarrhea, some upset stomach or abdominal cramping. And then this one does have a rash sometimes associated with it, although it is different than that very distinct bullseye that's with Lyme disease. It's kind of this spotted irregular rash, so you can see on the right here. So if this is something you see, this could potentially point to Liquiosis. And then doxycycline is also recommended as an antibiotic to potentially treat this if necessary. And again, as with the black-legged tick, that was with the two previous diseases, Aplasmosis and Lyme disease, both the nymph and female adult stages can spread the disease, and they're most active in the time when we're active in that spring and summer season. Although it's not unheard of in the fall to have potential Lyme or other tick-borne diseases, it's just less common. The life cycle then is usually the adults. They can see them bigger, and we're outside a little less, but it is a potential. So something to keep in mind if you are a year-round active outdoor enthusiast. And then our final tick-borne disease that we're gonna discuss here is babysiosis. This is caused by the parasite Babysiosis macrata, and it's carried by the black-legged tick. So there's not a whole lot of data for Pennsylvania in regards to this disease, just because it's not really common and it can be hard to identify through testing if the correct testing isn't run. So there's just not a whole lot of data to aggregate and give accurate numbers on, which is a good thing, not something you have to super worry about, but wanted to make you aware today. A lot of people are actually asymptomatic with this disease, but if you do develop any symptoms, they can be fever and chills, body aches and potential fatigue, and then red blood cell count can also be associated with this. And treatments can vary. Sometimes there's a combination of antimicrobial medications. Your doctor or physician will definitely be able to discuss the best course of treatment based on yourself. So definitely something to follow up on if you do have any concerns or questions. So that will kind of conclude our tick-borne disease discussion. And we're gonna now kind of shift into the mosquito-borne diseases. So some of the ones that have been seen in the US and are endemic in other parts of the world are West Nile virus, Zika virus, malaria, and dengue. All right, so some mosquito-borne diseases, they're typically rare in the US, and most cases that are identified here are associated with routes and travel to endemic areas. Although this is mostly the case, West Nile virus is seen in the US, but at very low rates. There were 7 cases of West Nile virus in PA in 2019. So something that's a little more prevalent. It's not a huge transmission rate, but we do see it here in the US. The best way to kind of avoid mosquito disease and bites are just good prevention strategies. And then if you are planning to travel, plan ahead, know what is the potential risk when you're traveling there, and then take further action from there. So actually June 8th of this year, the Pennsylvania Department of Health put out an alert. They call it a PA HON regarding West Nile virus. And actually the first West Nile positive mosquito pools were identified. And they were identified in both Lebanon and Beaver counties. And they were actually found through routine surveillance that is done by the Department of Environmental Protection at the state. So they test kind of these pools that may lead to the breeding of mosquitoes and may carry these diseases. They routinely kind of survey them, test them. If they do find these potential pools, they do have some treatment that they can do in that area. So just send us something to note. It's pretty interesting. I think these were the first true pools in general, not just this year, but in Pennsylvania. So we are seeing it become a little more prevalent. And the West Nile virus is most common through July through September. But interestingly enough, those who contract West Nile virus, about 80% of them are actually asymptomatic. They don't ever experience symptoms. They may not know they even have West Nile virus. 20% experience this generalized febrile illness, so a little bit of a fever, maybe malaise, just not really feeling great overall. And then less than 1% of individuals would develop into some sort of severe neuroinvasive disease where they may need to seek some sort of higher care treatment, maybe in the hospital for some time, but again, very rare. And then mosquitoes become infected with whatever virus they may carry when they feed on infected birds. And if you do have any sort of concern or thoughts that you may have West Nile virus or one of the other mosquito-borne diseases, it's really important to kind of notify your doctor that you've traveled and any potential exposures that you may have had, where you might have been. That would give them some clues and maybe what a differential diagnosis might be, what they could test for. And that 3-week window prior to symptoms is really where you would want to focus that information. All right, so to prevent mosquito bites, best thing is to also use that insect repellent and make sure it has that active ingredient that's approved by the EPA. So DEET is one of the bigger ones that we discussed earlier, and then picaridin is another one. And picaridin is actually used to treat clothing, outdoor equipment / camping equipment. It's not always recommended for skin use. And if you do, you would want to use a lower percentage of that and just be very mindful to follow the instructions very closely. But that's typically used to treat kind of your outer layer of clothing and gear that you're carrying with you as you're through the outdoors. One thing that's very important and a little different than with the prevention of tick bites is to remove any standing water or items that may collect water. So although bird baths are really pretty, that carries and collects standing water that kind of becomes stagnant and mosquitoes are attracted to and kind of can thrive in. Sometimes like buckets overturned that can carry just a little bit of a pool of water. Anything that's kind of just left outdoors and not maintained, you would want to make sure you just dump that relatively regularly, make sure the water's cleared out, or just remove it entirely from the outdoors. That's the best way to prevent any sort of mosquito infestation in your area. And then the remainder are the same, the long sleeve. And then if you're traveling, you'll want to make sure you choose lodging that has air conditioning, so you don't need to use any sort of window as a cooling mechanism. And then if you do opt to do that or use windows in your own house open during the kind of spring and summer months, make sure you have a screen there to prevent the mosquitoes from flying in directly. And then one interesting thing to note, as a prevention for Zika virus, you would want to use condoms when having sex because Zika virus can actually be passed sexually. So that's just something a little different than the others to note. It's always good practice to use condoms in general when having sex, but especially if you feel like you are traveling or might have been exposed to Zika virus. And just elaborating a little more on what Zika virus is like, you could have anywhere from mild to no symptoms, and they're, again, generalized fever, rash, headache, joint pain. Some red eyes can be associated as well. And just so you're aware, in 2019, there were actually no confirmed cases of Zika virus reported. So again, it's not very common, but if you or someone who's pregnant, that could be a concern as well, and then, can be passed sexually. And that is the conclusion of my presentation. So thank you so much for having me. I'm happy to answer any questions that you may have about any of the tick-borne or mosquito-borne diseases.
Alexis, that was great. Thank you so much. I learned a ton. We do have some questions for you.
Great.
So I know that you did mention, but could you mention again some specific brand names of pesticides that could kill ticks?
Sure. So that's something that I don't have a whole lot of knowledge on, so I do apologize in terms of the pesticides. Definitely want to look at the EPA approved because they can vary depending on the quantity, and things can be different, especially across borders as well. So there's definitely an EPA approved list, and even some kind of natural plants can be planted to kind of deter ticks. So like lavender and rosemary, things that are very fragrant, can actually be planted to kind of deter ticks and keep them away. So if that's something that someone's really into gardening, those can be kind of some plants that you can include as well. But unfortunately, I don't know any specifics that are environmentally based more than like personal protection.
Yeah, and could you speak to the personal protection again, like the DEET and the...
Sure, yeah. So most products that you would buy, so like Off is one of the big brands that uses like tick repellent or anything like that. And you can buy DEET concentrated as well. So those are just some options. More of the concentrated items are found in like more specific sporting goods stores. They're not as widely available as some of your products that you would find on the general store. But if you look on the back of the ingredients, it should say, what is included. DEET is one of the most common ones, and then it'll also show the percentage. So most include for hire, which is perfect. All of that is safe to kind of spray on your open skin if you do have some sort of sleeves or you choose to spray before you may put your shirt on. They do recommend, if you want to put it directly on your face, to kind of spray it in your hands first and then pat that on your face rather than a direct spray, just to kind of make it a little gentler on your face. It is a more sensitive area. But anywhere, I believe, from like 10 to 30 is kind of the sweet spot. It's high enough. It's not like overdoing it without being extra protective. And I would say every 2 or 3 hours that you're outdoors, it would be effective to respray yourself if you're going to be out there for any sort of length of time over that.
Yeah, kind of like sunscreen. You have to reapply.
Yep. Just like sunscreen. And I would encourage you to use sunscreen at the same time. And if you can time it and do it both at the same time, that would be great.
Next question is how to kill ticks on dogs.
Yeah, so a lot of tick brands, whether they take the chewable pill or it is some sort of collar or, kind of that gel that you put on the back of their neck, most of them are pretty effective, but we are seeing kind of higher numbers of ticks this year with the wet season and just the transfer. It kind of varies from season to season, but it is predicted to be a higher tick population season this year. So, your dogs may kind of carry them on them anyway. And the best way is to kind of give them that preventive measure, whatever form is best for them. And then those tick checks and removing them as soon as possible before they really attach and kind of dig in and start to feast on them. Those are really the only ways to prevent them. I don't think I would recommend spraying what you use on yourself to spray on them. It's really not recommended or designed for that intent. So I would be hesitant to do that.
And then our final question, if ticks start lower on the body, how can they move up to the body so quickly, like in your hair, armpits, things like that?
Yeah, so they can crawl, definitely at a slower pace, especially since they're so small. I think the ways they can potentially get in your hair is if there's hanging trees or brushes, where you may have to like kind of duck or kind of crawl under them where you may brush against it. That would be the most common for you to get something kind of in that upper region. But they could be small enough that you kind of catch it within your, first 5 to 10 minutes outside. And let's say you're taking an hour, walk in the woods and they kind of travel up your body and you don't even realize it. Like if you have shorts on and they kind of travel under your shorts and you don't realize they could hide in the back of your knee. And then, a couple hours later when you're home and you're cooking or getting a snack, then they kind of travel a little farther. So the longer they're there unknowingly, the farther they can move up your body. And they just kind of want to find a spot where they can attach on real good, feast, and almost like hide, wherever is a kind of a cool spot. That's why they like to hide in those kind of crevices, like the back of your knee, potentially even your groin area. They could do like the crevice of your elbow. So that's something you could see a little more prevalently. So they kind of have no preference, just as long as they can kind of attach it and get at you. So you'll most likely find them in your lower region, but the longer they are on you, or depending on where you brush, they could be in the upper regions of your body.
Thank you. Well, we don't have any more questions. I think this was so important, especially right now. I know a lot of us are getting back outside. So thank you to Alexis and thank you to everyone who attended today's webinar. Once you leave today's webinar, you'll receive a quick 5-question survey. We would greatly appreciate if you could take a few moments to provide your feedback so we can continue to improve in the future as we bring you more VigR wellness webinars. You'll also receive a follow-up email tomorrow afternoon with a link to view the recording of today's webinar. You can view the webinar again and also share it with others. You can find recordings of our past wellness webinars on the Friends Life Care website. And I also wanted to let you know about our upcoming VigR programming. We're offering a 6-week Tai Chi course starting on Tuesday, July 13th at 11 a.m. Our next VigR Wellness webinar, Using Mindfulness to Thrive, will be held on Tuesday, July 20th at 11 a.m. The follow-up email you will receive tomorrow afternoon with a recording of today's webinar will provide a link to learn more and register for either or both of these events. You can also register on our website. So thank you so much and have a wonderful rest of your day.